Today I would like to discuss the whole process of how to get a surgery done with us here in Latvia. So that usually starts with appointment with neurosurgeon. Neurosurgeon meets patient, patient meets neurosurgeon, neurosurgeon learns about patient's complaints, review images, and let's imagine there is indeed a need of a spinal surgery. It can be neck or it can be lumbar part, whatever. So the next step is surgeon is usually offering. So we can do this surgery as we operate on the basis of private hospital. There are no long waiting lists. We can actually offer surgeries in most cases within 2 to 3 weeks notice. Which means, let's imagine patient is willing to have a surgery in 3 weeks. Which means on the day before surgery, patient arrives to the clinic. By the way, support from our coordinators is always provided if patient needs any help to make arrangements, travel arrangements or hotel recommendations or whatsoever. Full support is provided. But patient arrives to the clinic day before surgery for clinical workup, which means blood tests, ECG, chest X-ray, anesthetic review. And usually patient also meets with a neurosurgeon again in day before surgery, just to discuss once again what exactly is going to be done during the surgery and what effects can we await from the surgery to manage patient's expectations. So, and also important part is to discuss a whole range of possible complications. By the way, patients usually ask me, is this surgery risky? Is it dangerous? The general answer is no. Surgery is not very risky, is not very dangerous, but there is a slight risk of some complications to happen. And there is a big list of things that can go wrong. Some of the things are completely innocent and can be easily managed. For example, wound dehiscence. Basically, wound is not healing as good as we want, and we can do something about that. That is no problem. And of course, there are more significant, more important and more dangerous complications, but those are extremely rare. Next day is the surgical day. Patient briefly meets surgeon before surgery just to make sure everything is fine and patient is ready for surgery, and patient departs to the surgical theater where he is meted by anesthetic team, and the patient is put asleep under general anesthesia in most of the cases. Then surgical team arrives and performs surgery, and after surgery is done, patient stays in the surgical theater again with the anesthetic team who is wakening up patient. Once patient is waken up, he or she departs back to surgical ward where he stays under supervision of the nurses. Most of the surgeries nowadays are done in minimally invasive fashion, which means that surgeries are easy to tolerate, and which means that patient does not need to stay for long periods of time after surgery in hospital. In typical scenarios, we are able to discharge patients back home or back to hotel or back to Airbnb, wherever they like to live, on the next day after surgery. In some cases, if surgery is very minor, patient can be discharged on the same day after the surgery, and vice versa. If there is more extensive surgery, which is rare nowadays, then patient can stay up to 2 to 3 days after surgery just to remain under a radar of the medical staff. So, but in typical scenarios, patients are discharged on the next day after surgery, and typical recommendations involve to take it easy for 2 to 3 weeks, which means not to overdo physically. And we also recommend to use a lumbar or cervical brace after the surgery, as brace provides stability, it lessens pain and provides comfort and improves quality of life after the surgery.